think one of the cultural breakthroughs related to that, aside from all the specific technique pieces, has to do with when you look at benchmarking. That's, and I'm a manager, that's an external thing that somebody's trying to impose on me, and I have no control over that. So in the end, it's about ownership and control. I don't own that benchmark, and I don't control it. It's an external to in. Being quality staffing gives you culturally an opportunity to go inside out. It gives me the ownership in helping set, this is my range of quality I'm trying to stay within, I want to be within with my staff, that I've put my thumbprint on with my team and so on. We got the buy-in. And so I own it, and I feel some control over that. The other thing is then I feel like I'm playing offense instead of defense, which psychologically and motivationally is a huge difference, again, multiplied by multiple people, etc. So the in-quality staffing tool was a critical process learning. It also got us away from what we and many in hospitals have used forever, which is a grid or something based on hours per patient day, which is fine for finance guys to look at overall, over long periods of time. But as you know, patients don't experience our averages. They experience our variations, which means by shift, if not by hour of the day, when staffing and demand are not matched as well as they should be.
Therefore, we are going to be proactive. With the growing demand and impending nursing shortage, I believe we have to work smarter and look for ways to meet patients' needs differently than we did before. We began with this question: how do we make sure you have the resources to continue to provide safe care and feel great about that care when you leave every day? Next, we reached out to our nursing staff to gather your perspective on what we might do and how we might make your jobs easier. Now, with much input from you, we are implementing a pilot project to improve quality of staffing to ensure our mission for the Nursing Institute is carried out. We are calling this initiative In-Quality Staffing. In-quality staffing to us means having the right caregiver in the right place at the right time to ensure that every patient's experience is exceptional. We believe this initiative is a solution to our primary staffing challenges.
We have to be innovative in our ability to use different personnel, different support people to manage our patient care.
We are committed to furthering our legacy of nursing excellence at Cleveland Clinic and will continue to deliver on the promise of world-class care.
We did the in-quality staffing, the initial part of the engagement with Caldwell Butler, and had a great result with in-quality staffing. And it's been, what, 4 years since we looked at it, and we decided we'd look at this last framework out. And we got Chip to come and work with us again. He gave us a suggestion: why don't you do a PsyPod along with in-quality staffing, not just focusing on departments, but focusing on the flow, the surgical patient, the medical patient, at the same time you're doing the department.
That PsyPod, it was the most energized that I've been in years because of what it showed us was hidden that we couldn't see, the opportunities. We can't even do them all that we found in the revenue cycle, IT constraints, whatever, but we know they're out there and we've got a list now. Okay, we want to go after this one. Can we weed this one in? And so we've got to.
A lot of it is casting the vision that we've got to take cost out.
And increase rate.
And increase rate. We can do cost out by, we'll just get rid of people, or we'll do the dastardly things, or you as a manager can find stuff that you can literally take out, and it's actually not going to hurt anybody. It's going to make their life better and actually may make it more efficient. And I think they get into the sense that if I don't do it this way, this is what could happen down here, and they really get on board. And I think it's
taking pride in that.
taking pride in it.
Finding going, wow.
Well, and another point is, all of our managers have margin goals that are usually somewhere in the 40% to 50% part of their incentive plan. So in the year they find it, they're helping themselves make their margin targets in that year. And then it'll come out of the budget the next year. So real time, they're getting a tangible benefit that
Back for all of the previous changes and use the Pareto principle at 28 and ask accounting to get with all of the folks who put things in the green catcher and validate them, see if they were still true and if they were in place. And the number was 93% of everything that we had found that was dark green was still there.